Welcome to Pharmacology Insights, where we break down complex pharmacology into simple, easy-to-understand concepts. Have you ever felt nauseous, dizzy, or on the verge of vomiting during a car ride, a boat trip, or turbulence on a flight? If so, you are not alone. Motion sickness is extremely common, and yet the way we treat it has barely changed for decades. Traditional medications, such as antihistamines and anticholinergics, come with familiar trade-offs, including drowsiness, dry mouth, and impaired alertness. Effective, perhaps, but far from ideal. In this video, we will explore Tradipitant, a novel drug that targets the problem at its neurological core. Approved by the U.S. FDA in late December 2025 under the brand name Nereus for the prevention of motion-induced vomiting in adults, Tradipitant represents the first new pharmacological class for motion sickness in more than 40 years. Unlike older medications such as scopolamine or meclizine, Tradipitant works through an entirely different neuropharmacological pathway. To understand how it works its magic, let us first look at how motion sickness develops. Motion sickness occurs when the brain receives conflicting sensory signals. The vestibular system in the inner ear detects movement. The eyes may see a stable environment. But the brain, it struggles to reconcile these mismatched signals. This sensory conflict activates central pathways involved in nausea and vomiting, particularly within the brainstem. When this mismatch persists, it triggers the release of Substance P, a key neuropeptide involved in emetic signaling. Substance P exerts its effects by binding to NK₁ or NK₁ receptors, which are highly expressed in the vestibular nuclei, the brainstem vomiting network, and the area postrema. NK₁ receptors are GQ11-coupled, GPCRs. Their activation leads to increased intracellular calcium, enhanced neuronal excitability, and amplification of excitatory synaptic transmission. Through this mechanism, Substance P amplifies signaling within the brain's emetic network, particularly in the brainstem, lowering the threshold for nausea and triggering the vomiting reflex. This is where Tradipitant comes in. It is an oral, high-affinity, selective NK₁ receptor antagonist. In simple terms, it works by occupying the NK₁ receptors, effectively blocking Substance P from binding. Without that key interaction, the emetic signaling pathway is disrupted. As a result, nausea and vomiting are reduced. Tradipitant acts within the central nervous system, but in a highly targeted way. Rather than broadly suppressing vestibular signaling, as older antihistamines and antimuscarinics do, Tradipitant selectively blocks the NK₁ receptor. This allows it to reduce nausea and vomiting without relying on sedation or anticholinergic effects. The FDA approval of Tradipitant was based on two randomized, double-blind, placebo-controlled phase 3 trials, MOTION-SYROS and MOTION-SERIFOS. Both studies enrolled adults aged 18 to 75 years with a history of motion sickness during travel. Study participants were randomly assigned 1:1:1 ratio to receive a single dose of Tradipitant 85 mg, Tradipitant 170 mg, or placebo, approximately 60 minutes before a boat trip lasting about 2 to 5 hours. The primary endpoint in both trials was the incidence of vomiting during the voyage, assessed every 30 minutes using a standardized questionnaire. In the MOTION-SYROS trial, vomiting occurred in 20% of participants receiving Tradipitant 85 mg, and 18% receiving 170 mg, compared with 44% in the placebo group. In the MOTION-SERIFOS trial, vomiting occurred in 18% of participants receiving Tradipitant 85 mg, and 10% of participants receiving Tradipitant 170 mg, compared with 38% with placebo. Essentially, Tradipitant produced statistically significant and clinically meaningful decreases in vomiting, with a favorable safety profile across both studies. This approval marks more than just another treatment option. It signals a shift toward mechanism-based therapy in motion sickness. For the first time in over 4 decades, patients have access to a therapy grounded in modern neuropharmacology. One that targets a central driver of nausea, without the limitations of sedation or anticholinergic burdens. And that's it for today's pharmacology video. If you enjoyed this video, please give it a thumbs up and subscribe to the channel for more pharmacology content.